Okay, so today's video is going to be discussing shoulder pain and specifically rotator cuff pathology. So in the video, we'll discuss the specifics and kind of the basics of how the shoulder works, the anatomy of the shoulder, and then we'll talk a little bit about how degeneration of the tendons and the muscles can eventually lead to a rotator cuff tear. If you like the format of this video and you're interested in more physical therapy related content, please subscribe to the channel. And yeah, let's get into the video. Okay, so this picture gives us a great view of the rotator cuff on both sides of the shoulder. So in general, we have four muscles that are involved with the rotator cuff, and the main function is known as dynamic stabilization. We will get into this more in the video, but the idea is that the nervous system and the muscles are communicating to keep the shoulder joint in place. So if we just focus on the left side of this picture, we are looking at the back side of the right shoulder. This is where three of our four rotator cuff muscles live. Starting from the top, we have the supraspinatus, the infraspinatus, and the teres minor muscles. The supraspinatus functions to abduct the shoulder along with the deltoid, as can be seen on the right here. When the muscle contracts, the force works to move the arm up overhead. Now the other two muscles, the infraspinatus and the teres minor muscle, rotate the humerus when the arm is at the side, which looks something like this. Moving over to the right side of the picture, we are now looking at the front side of the right shoulder. This fan-shaped muscle you see on the front is the subscapularis, and it's responsible for rotating the shoulder in towards the body. The goal of the beginning of the video was to help give an inside look and a visual of what's happening in the shoulder so that we can better understand the biomechanics and what's happening when we tear the rotator cuff. Rotator cuff pathology is an umbrella term for multiple different things and can refer to tendinitis, tendinopathy, bursitis and impingement, or a degenerative tear. Rotator cuff pathology is very common, with approximately 40% of individuals over the age of 60 developing a tear. Risk factors for rotator cuff tear include smoking, jobs and activities that require overhead lifting and throwing, aging, and the onset of diabetes. Smoking and diabetes decrease the blood circulation in the shoulder, which is vital to getting oxygen to those tissues for healing. Let's look at the mechanics of how we develop shoulder pain in rotator cuff pathologies. This image does a great job of showing the difference between normal shoulder mechanics and faulty shoulder mechanics within the shoulder joint. This image zoomed in shows how the deltoid pulls up the humerus as the supraspinatus assists with the motion. The head of the humerus spins as the shoulder rises overhead. While that happens, the backside rotator cuff muscles are simultaneously firing to pull the head of the humerus down to keep it in place. This is really how dynamic stabilization works in practice during overhead movements. This image shows what happens when our shoulder mechanics begin to break down. The deltoid pulls up as usual, but notice the difference in the supraspinatus. There is now reduced space between it and the acromion, something that we call impingement. This reduced space starts to cause increased friction that leads to inflammation and pain. You can see that the head of the humerus is driving straight up rather than spinning. This may mean that the rotator cuff is not strong enough to do its job properly. Over time, inflammation begins to form and the tendon becomes painful. This is known as tendinitis. Many people with shoulder pathology present with the painful arc sign. This is pain between 60 and 100 degrees of elevation. Eventually, the tendon weakens to the point of tearing and the shoulder loses even more functionality. The supraspinatus tendon is the most commonly torn of the rotator cuff muscles, and it's hypothesized that it's because of its proximity to the acromion that this happens. But it's very possible to tear the other rotator cuff muscles as well, like the one that's shown right here in this picture. This video is the beginning of a series of shoulder-related videos. If you're interested in exercises to help keep the shoulder healthy, click in the upper left-hand corner. And once again, thank you for watching.